the PhD superpower that I think we all sort of learn and develop is being able to learn quickly, I think, and figure out, the terminologies and the models and the world, the views that are described in the civic tech space that I'm in now are essentially equivalent to these terms that we use in public health and health policy, right? And so I think part of this is like learning to identify what are the commonalities and how we can in some ways exploit those, information that we already know. And for those that we don't, we can quickly kind of get up to speed on it just by learning and talking and asking the right questions.
Hello and welcome to another episode of The Next Step. I'm Jeff Kozlowski, your host. Today we have Michael Chen. He is a 2019 graduate from our Health Services Research and Policy PhD program. Excited to talk to him about his graduate experience, becoming a professor, sort of getting that dream job at a local university, and then pivoting to now partnerships and evaluation lead at NAVA. And we'll talk all about what that is, what that means. And our faculty co-host today, Chris Seplaki. Thank you so much for joining us. Chris is currently a professor in the Department of Environmental Medicine and Public Health Sciences, newly named Environmental Medicine and Public Health Sciences as we record this, and he is director of our Masters of Public Health program. Chris, anything else you want to add?
No, thank you for having me. I'm delighted to be here. Thank you.
First, what is the significance of having you both here together today?
Mike and I certainly had spent time together during his time in the department. I first met Michael, when he was an RA for me. But I think we're able to share a perspective on the department and his time there and that influence and what he's done since. That's insightful.
All right. Michael, what do you remember about first impressions of Chris?
Yeah, I worked with Chris, Dr. Seplaki.
Is that weird to say?
For a couple of years.
I've been trying to get him to say Chris. But
I'm working on it.
He refuses to say Chris.
I think one really big role that Chris played in my graduate training actually was you pointed me in the direction of fragile families, which ultimately became sort of the foundational data set that I was able to do my project with Dr. V's supervision. And just being able to talk to you about data, writing clean syntax when it comes to programming, even just like I think thinking about the world, family formation, and all the different things we talk, like even personal, like what it means to juggle career and family. I think all those things I took away from you and learned from you as we sat in your corner office and that with the window looking out to the parking lot. So it was very transformational in many ways. So thank you for being here with me.
Happy to be here.
And so, Michael, let's go kind of not way back, but back to the beginning. You were born in Taiwan, that's right, but grew up in Toronto.
Right.
How did you end up in Rochester?
Yeah, long story short, a computer sent us here. Yeah, so I came to America for undergraduate, met a girl who later became my wife, and she was in medical school, and so she matched for residency here at U of R at URMC. And so in 2010, we packed up our things in Rhode Island. I drove a big U-Haul across I-90 and landed in Rochester. And 16 years later, we're still here, and family is here now, and work and life. And
yes.
So, yeah.
And we mentioned you went through our Health Services Research and Policy PhD program. What originally attracted you to go into that line of work?
There's a professional reason and sort of a personal motivation. I think the professional reason being, after I graduated from college, I had a job in community organizing and then another job in sort of public health consulting. And I think, as is often the case in these sort of entry-level roles, I was sort of primarily executing plans, right? And so there was sort of this part of me that maybe it was the arrogance of youth as well, sort of like, oh, I can do this better. I want to drive the bus, right? I want to be able to determine what direction we pursue. And so I think one, talking to a couple mentors and friends, I think they sort of suggested, why don't you think about going back to grad school? So that's sort of where I started exploring. And I think the personal reason is because, um, I think my family members, growing up, I'm the son of a teacher, grandson of a teacher, brother of a teacher, and I think they sort of had, in some ways, had hoped that I would continue to pursue education. And so I think that's sort of like one way to do it. I sort of often jokingly tell people that, before grad school, we would get mail and it would say Mr. and Dr. It would say Mr. and Dr. Michael Chen, me and my wife. So I just got tired of being the Mr. and I thought maybe it's time for me to upgrade. But I think, years later, it still says Mr. and Dr. Michael Chen, which is fine.
So you graduated undergrad, went to work full time, and then came back
Yeah.
to graduate school to pursue
Right.
a
It was
PhD.
about 3 years of work.
What was that like, coming back to school after being out for a while? Was it hard to kind of jump back into the routine?
It was actually great. The reason for that is because being Canadian, I had to go through sort of immigration application in order to remain in the United States with my wife. And so during that application period, I couldn't really work and couldn't really do much. I couldn't leave the country. And so I remember 2010, my wife was starting residency, working 80 hours a week. My time was split between baking cake, playing with our puppy, and playing the Xbox. And so when it came time to start up school in August 2011, it was, I'd look forward to it and really wanted to get back and learn and use my brain in other ways besides, what I was doing the months prior.
That explains a lot. If I could interject a little bit, rarely have I met someone who has enjoyed, sort of effusively projected an enjoyment of graduate school and their time in graduate training as Michael. It's sort of it was easy to sense that Michael really enjoyed being in that environment and engaging in that space, that intellectual space. So.
Yeah, it's fun to learn. I will say, it wasn't always fun. I think there were, moments.
There's always moments acknowledging that.
Yeah, I mean, overall, just really, I wouldn't change a thing. I think, I would do it again in a heartbeat. Yeah.
You hit on your thesis work a little bit, and as we record this, we're June. As when this comes out, will likely be a little bit after Father's Day, so it kind of hits on that theme a little bit. You looked at paternal economic support. Can you just sort of talk about your thesis work and kind of how you sort of navigated and got there?
Yeah. Well, I mentioned, Dr. Seplaki, Chris pointed me to a data set that happens to have super rich insight into particularly unmarried families who are navigating economic hardship, right? So it has data from child development. It conducts interviews with fathers and conducts interviews with mothers, also with daycare providers and teachers. So you sort of have this interesting multi-angle look on sort of the ecosystem of child development. And how I kind of got here was, so my primary thesis chair was Dr. Peter Veazey, and he really sort of pushed us to think about the value of theory-based explanations. So trying to understand mechanistically what, why are these things happening that's driving or hurting child development. And so I think that's sort of one. I think I've always been interested in kids, sort of, studying how do kids thrive and what are the conditions that are needed. And I think the other sort of interesting collision for me was, at the time of trying to come up with an idea, we were expecting our first child. And in some ways it was sort of like, how do I read these parenting books and not, and still try to sort of exploit that time and effort I'm spending in reading these pop psychology books and, 1, 2, 3, I forgot what the titles are, but, all those parenting books. And so sort of just tried my best to, two birds, one stone, right? To kind of like, how do we turn this into a graduate thesis endeavor? So, Yeah.
Yeah, I would add, you had said you sort of, the project we worked on together. So again, Michael and I came together. He was an RA for a project. The project was focused on fertility and microsimulation of fertility outcomes and sort of a technical sort of project. But it was very clear, when Michael had come in that he had a deep substantive knowledge in this area, an interest, a drive to try and understand these facets and what drove these kinds of these relationships. And I think that's somewhat unique in graduate students that the focus on why they're doing what they're doing, what it means, what its impact may have, sometimes comes later. But with Michael, it's very apparent very early that this is what he wanted to do in the space he wanted to be in. That was clear on our first day before we really got into my project. So.
Yeah, I think we were sort of swimming in the depth of the National Survey of Family Growth and the Health and Retirement Study, which are two really rich nationally representative data sets that contain family formation and trajectory and how they change over time. I think part of the excitement, the joy of learning and discovery is poking around these data sets and see what variables there are, what patterns emerge. And so, yeah, I think some of my motivation came from experientially, just let's see what measures are in here and what can we sort of glean from these. Maybe the plain language answer is I just didn't want to screw up, being a dad. So as much as I can read up on it and conduct research to better understand, what the fathers bring to child well-being, that's sort of maybe my intrinsic motivation.
On top of that, you had all intentions of going into the education space, right, and becoming teaching at some level. Now, I know folks, some graduate students, like their thesis just is what it is, and that's a project they decide to work on, and then don't necessarily pursue that work afterward. Did your sort of pursuit in this thesis kind of did you have any thoughts of how to bring that to what you wanted to do afterward, if that makes sense? Maybe it's on a more broader level, passing along the importance of this kind of knowledge to other people, but just curious.
The theoretical foundation is a sort of this cascading sequence of things, right? It's called the family stress model that basically says when parents encounter family economic hardship, it causes them distress, it compromises their parenting, it generates conflict between the parents, and ultimately affects their parenting behavior. Because in school, I'm thinking about it all day and all night, sometimes quite literally. I think that was sort of the lens that I was looking, through just about everything in life, right? And I think certainly, I hope I'm answering your question, Jeff. In a personal sense, as a father, I think that work was really informing what I was doing on a day-to-day basis. But also academically, I can sort of see, I remember pursuing research projects and grants that were related to father involvement, trying to understand, how can we pursue community initiatives that promote father involvement. And so, yeah, I don't know if I totally answered your question there, but
for sure. And then real quickly on the thesis defense, you mentioned you're in the thick of so you were expecting when you first got into when you first started getting sort of specific about this is what I'm going to do this project on. By the time you defended, you were a dad, right? And had your at least first child. There's a funny story about your actual thesis defense that relates to being a dad and being in the thick of parenthood. And I think you know where I'm getting at. Do you mind sharing that story?
Yeah, I think this is the one where I showed up to the defense with a sippy cup, right?
Most people, bring a water bottle or something. But was that just a conscious choice on the way out the door? You're I can't worry about this right now. This has water in it. Or was it to be You wanted to maybe show something to the crowd, like this is where I am in life, and because it kind of did relate to your thesis ultimately.
Yeah, I think in 2019, my child 1 was 5 years old and child 2 was
Oh, so you had both.
2 or 3, right?
Uh-huh.
And so, yeah, Sippy Cup was definitely in the picture, and I
Uh-huh.
think it might have just been the nearest thing that I grabbed.
I'm guessing proportionately it was probably the more likely thing you would grab from a cabinet
Yeah.
in a household like that.
I think it was probably by the door as I was
Yeah.
walking out. I'm sort
Love
of
it.
visualizing my house. I
Yeah.
think that may have just been the impetus.
One by the door, one on the table, one on the
Yeah.
cabinet. Yeah.
And it had zero effect on the outcome, right? So just for trainees that may be watching, if you're in the thick of and you're late, not late to your thesis, but you got to get out the door.
I think
grab
that's-
what you can grab.
I think the technical answer is we don't know because there's no counterfactual, right?
That's right. That's right.
We're actually not sure.
That's right.
We need more data to really properly answer this question.
Spoken like a true PhD
Nerd.
trainee here. I didn't say that. Chris, can you just talk a little bit now about our public health program, maybe how it stands out, and just kind of maybe some of the uniqueness of it?
Yeah. So we're a department, EMPHS, Environmental Medicine and Public Health Sciences. We're a department, research-focused department in a major R1 research institution. But I think our department and its educational programs have certainly research as a priority. But I think our programs, we have a number of different programs, 3 PhD programs now, 4 master's programs, 5 certificate programs. We also, I think, blend a research orientation with a practice orientation and sort of a workforce-facing orientation, perhaps more than other departments, proportionally more than other departments in the institution. And so, I think a question I would ask Michael is, how has that environment and that orientation, sort of the blending of orientations within the department, influenced your time with us in the department?
Yeah. Well, I think, as I look back, so at one point, I think I was Chris's RA for about 2 years or 3 years. But I was also an RA in ophthalmology at one point, working with Dr. Holly Heineman. I was Dr. Paul Duberstein's RA in psychiatry. I worked with Dr. Cindy Rand and Jill Halterman in pediatrics for a while. And so I think, to Chris's point about workforce development, I think the opportunity to be immersed in these different departments and looking at different public health issues and problems is really valuable, both from a content perspective, right? Because how can we take the methods and the tools that we're learning in these classes and apply them to different settings, right? The same regression approach can be, we can use it to predict dry eye and outcomes, and as asthma diagnoses and allergy outcomes. So I think that's sort of like a really important, content exposure. I think just as importantly, if not even more, is sort of the learning how to be a professional and learning how to collaborate with other people who may have similar or vastly different ways of working together, communicating, seeing the world. And so I think, as a graduate student, as a graduate research assistant, basically working as a research scientist on these projects is really immensely beneficial, I think. And, I remember going on job interviews and talking about sort of each of these engagements and not only the products that come out of them, which oftentimes are papers and conference presentations, but sort of like how we, how do you talk to a social worker, an oncologist, a psychiatrist, physician, a primary care, and a nurse, and put them all together in one space and make decisions and come up with a research project about shared decision making, let's say. And so I think that finding alignment, making compromises, communicate clearly, negotiation, like all of those things, as I look back now, are what I took away from all those. I think important workforce skills, right?
Yeah.
So,
Professional leadership, sort of foundational skills in professional leadership.
It's one thing I know sort of Rochester tries to sell itself on to prospective trainees is like the team science, the collaboration. We mentioned it at the top. The Department of Public Health is now Environmental Medicine and Public Health Sciences. Chris, can you touch on just kind of quickly what that means? How could that benefit trainees in the future? And what it means for current trainees and just the work we do here?
Yeah, no, I think it's a really synergistic integration that's taken place. I think, we have a number of our faculty in what was formerly public health sciences that were focused on environmental epidemiology, environmental health science, a number of collaborations that exist already with the environmental sciences folks. And so I think, the blending of the two departments into the new environmental medicine, public health sciences, it makes an enormous amount of sense. And I think it has created an environment that really does bridge between, basic science and population-based science in a very tangible, tactile way. I think it's something that gives students an experience and a view into both sides of what research looks like and what it can be here at the University of Rochester and in the School of Medicine and Dentistry. So I think our department serves as a good model of that integration, that ultimately that population view. I think also what, as Michael touched on, this blending of sort of research orientation, but also sort of workforce facing professional leadership is something that is approached very purposefully. I think in our department, I think it's something that we're all aware of. I think it's something that sort of baked in through. I neglected to mention we also have a preventive medicine residency that sits within the department as well. So we are very heterogeneous with regard to our educational mission. So I think those threads of fostering professional leadership, workforce training, being very close to what our collaborative communities need in terms of their research, but also in terms of their community service and their missions, is something that's very central to how we operate and how we go about what we do.
Michael, I want to go back to, I touched on the fact that, you had all intentions of going into a teaching role at some point, and you, during your orientation for graduate school, made that very clear, right? And I know that can kind of be hard for some folks to do, just understanding, a lot of faculty may want to train folks that want to go further do research and keep doing that science. And it may be hard to bring up the fact that, like, well, yeah, I'm going to do this program, but I want to go teach. How was that, and when I say you made it clear, like you said to, what was it, the department chair at the time, like, this is what I wanted, this is what I intend to do, which I think is obviously great to get it out there at the beginning and maybe later cause potential drama or something. But how was that received, and how did that sort of set the tone for your time here?
So I'm trying to rewind back to August 2011,
Yeah.
sitting in the Flom Atrium, which I walked by on the way here.
Yes.
And y'all probably know this, like from orientation, they put us in tables, they assign us seats with sort of people in the department. I remember the department chair came by and sort of had each of us introduce ourselves and just like one sentence explanation for why you're here. And yeah, I think when I got to my turn, I don't remember exactly what I said, but it was along the lines of, so I want to go, so I'm here so I can go teach, especially undergrads, about how fun it is to do public health and research.
There you go.
I think her reply was sort of like, that's interesting, how about graduate students? And so I sort of quickly recalibrated my answer to expand my, my pool of intended students to also graduate students. But yeah, to your second part of the question about how it informed my experience here. Well, I think in some ways, I mentioned earlier, like, there's so many teachers in my own personal life, and I've also benefited from the patience and wisdom and kindness of so many teachers, including Chris here. And so I think in some ways, like, that's what I has aspired to be, right? I remember my grandfather taught geography for like 150 years, it feels like. But I would, visit him, and we would ride a motorcycle down. This is in Taiwan. He would take me grocery shopping, and his students would just pop out left and right and hand him like bags of vegetables to take home for free, right? Like, I think it's, yes, the content teaching, teaching you a way of looking at the world is fascinating and gratifying and exciting, as you both know. But I think the other piece that really appealed to me is the opportunity to form these potential lasting relationships, right? To sort of see, in some ways, like it's like blowing seeds into the wind, right? And some of them you have the opportunity to see them grow and germinate and turn into little plants and trees over time. And I think that opportunity of creating, sort of contributing to, I don't know if it's calling legacy makes me sound like an egomaniac, but just sort of like, I think that seems like a worthwhile use of my time. And so, that's, I mean, in some ways that continues to be a direction for me, right? To find a way to be in service to other people, to build into other people. And yeah, and I think, sorry, I'm sort of taking a long wind to your answer, but I think I got a lot out of the teaching assistantships. Like, we were required to do 2 TA semesters here. And so for one semester, I think both actually, I had the privilege of being Kelly Thevenet Morrison's TA for her SAS class. And so, which is a class where you learn how to write syntax for a statistical package called SAS. And just like watching the way that she goes about preparing, slides for course, the way that she patiently answers students' questions and sets up office hours and troubleshoots them, guides them to the answer without telling them what the answer is. I think that being able to observe that is sort of like gave me affirmation, knowing like, whoa, this is something that I would like to pursue. And then at the time, I think U of R had a sort of a teaching as research. I think it was a fellowship. So I briefly participated in it, and just also to see that we can take research methods and apply them to study how teaching works, right? The science of teaching and learning. And so I think all those things kind of blended together for me and made me realize, hey, teaching is fun and rewarding, and this is something I want to do and figure out a way to continue doing.
And I think that's a facet of the department that Michael blended into really effectively. So we have a number of, as I mentioned, these educational programs. That means we have a lot of courses, a lot of students. So we have real communities of students, and it is a priority. We send people not only into research, but we send them into teaching roles and other professional leadership roles. And I think there is an important place for teaching within the department, and a number of our students graduate toward that, and they leverage those opportunities. Some of our faculty also teach on the undergraduate campus, and we have students involved over there as well. So I think we have a number of opportunities to allow students to explore that side of their professional interests as well. And I think as an institution, University of Rochester and SMD in particular, I think momentum is accelerating. You mentioned the science of teaching and learning. There's a new, Sarah Perry has led an initiative to develop a new Academy of Educators based here in School of Medicine and Dentistry. And that ultimately the goal is to be a center of excellence in health professions education. So I think that, that there has been momentum towards that for a long time. There's been a number of these initiatives spread throughout the institution, not just SMD, but across Rochester. And it has coalesced into these larger cohesive initiatives to try and advance the science of teaching and learning, within the SMD space. So, we have students like Michael that embrace that and take it as part of their professional development and ultimately their career choice.
I think I would just add also that I also benefited from faculty mentors who opened a door for me to do it, right? So another person in the department, Dr. Amina Leo, who also teaches a undergrad public health class, I think the intro class. And so at one point, in fact, there's been multiple times, I think now that I think about it, she sort of said, hey, come do a guest lecture on the U.S. healthcare system, right? And don't go too deeply because these are undergraduate students who are just, testing the waters. And I remember the first time just like panicking, right? Like, what am I going to do? There's 60 of them in here. Maybe it was, I don't remember. It was sort of a room like this.
Mhm.
But it's experiences like that give me an opportunity to sort of test the hypothesis that, hey, I enjoy teaching, right? And I want to help people learn, that my dad jokes are sometimes funny. So it's
They're never funny. Just let's be clear. My
Well-
kids have made it very clear to me that they are never funny.
I amuse myself.
Mhm.
But yeah, I think there's both like structured opportunities to explore teaching, but at the same time, I think there's also faculty mentors for me who have opened those doors for me and given me those opportunities to explore and encouraged me to explore and wrote letters for me to pursue those things.
So we should talk a bit more about Peter Veazey, your mentor. He was a valued mentor to you, as well as to many other students in our department. How has working with Peter shaped your view of the world and your approach to not only research, but your professional life?
Yeah. Thank you for that question. So Dr. VZ Peter passed away on Valentine's Day last year. I think it was sort of a sudden
Mm-hmm.
cardiac event, if I recall correctly. I had the pleasure, the opportunity, the privilege of being mentored by him for 8-9 years, something like that. And I think Chris, Dr. Seplaki, you hit it right on the nail, right? Like nail in the head, I think is the phrase. Like Peter really changed how I look at the world and think about
Mhm.
the world, right? And I know I mentioned earlier about his encouragement to us to not necessarily take only an empirical approach to studying problems, but taking on a theoretical explanation, in part because of the opportunity to generalize insight to other problems, right? Like if this theory works, we can take it to, screening for diabetes the same way we screen for other diseases. And, I think certainly from a knowledge training standpoint, he and so many others, right, both like formally on my committee as well as those like you who are not on my committee, but sort of really played a huge role in guiding my growth as a scientist, as a scholar, as a researcher. I think the other piece that Peter really sort of molded me is, he was incredibly generous with his time and he was incredibly patient. Um, we would have these conversations where discussions about methods or ideas and it's sort of this funny experience where I'm in when I'm in his office, everything kind of makes sense, yes, let's go, we know what the next steps are, and as soon as I walk out of there, it becomes a haze, right? And you're both laughing, so maybe this is
Yeah.
a familiar experience for many trainees. I think what's special though is Peter would gladly, genuinely glad, he would be glad to re-explain and go through and give examples and to have the same conversation again and again. Partly, I think it's because he forgot that we talked about it, or
Maybe.
just that his incredible patience. I think he has a hiding spot. He used to hide, quote unquote, hide in the Helenwood Hall, on the couches, and so like we all knew if he wasn't in his office where we could find him. He also has a secondary hiding spot in the med center. And so, the bunch of us who that he chaired, we always knew if Peter's not here, he's in backup location A. If he's not backup location A, it's backup location B. Yeah, and I think sort of the one other thing there's so many things that I can think about, that I appreciate about Peter. I think the other one I've really taken away from, especially during my couple of years as a faculty member, is sort of his intellectual flexibility, right? Like, I think what's unique about Peter is that in our division, health policy and outcomes research, I think dissertation project ideas tend to be sort of like an extension or elaboration of an existing project that sometimes faculty members are engaged in. Peter's approach was sort of like, you pick a topic and I'll come along with you and learn about it, right? And so I think in part that's why he's learned about decision making. In a cardiac setting, I'm trying to think about my other, cohort classmates topics, most of which may have been new to Peter when they first started, but Peter's sort of like intellectual curiosity, he just went along with it and learned about the topic. And I think the other part is just that, simply topics have overlapping commonalities, and part of the joy and excitement is finding out, hey, this thing that we use in area A is just as applicable to area B. And so I think, all of these things, and after Peter died, I think just hearing about who he was as a father, as a husband, as a brother, as an uncle, the things that I didn't get to see as much, in a formal SMD sort of classroom setting that I got to hear about, sort of completed the picture in my mind in some ways of like, wow, he was a good dude, and I think there's a group of us that we have a group chat, and it's people like Twyla, like Alina as well, that sort of, Teresa. I'm trying to think about the classmates that, we still talk about Peter in part because of the foundational impact he had on us. And also I think it's a way for us to honor the legacy and investment that he made in us to train and teach us how to think about the world and make it a little bit better.
Well said.
Thank you for sharing that experience. I think we would have been remiss to, not pay some respects to Peter in some ways. So thanks for sharing that. Want to move to teaching now. You finished up graduate school, got that full-time teaching role, sort of what you had worked toward. I know it was 2019, and then of course everybody knows what happened in 2020, pandemic, teaching especially. The whole world was flipped upside down, and teaching was no different, and maybe more especially so. What, impact did that have on you? And, obviously we mentioned at the top, you have a new role now, so we know you eventually left that space. How did all of that happen? Just talk about that experience and how things sort of shifted for you through the pandemic, I guess.
Yeah. I couldn't have planned it better.
Yeah.
Well, I graduated in 2019 May, started tenure-track assistant professor at Nazareth College, which is now Nazareth University, in a public health program. Had a really great first semester. Of course, the pandemic kind of happened in the spring semester, in the second semester of my year one, right? And I remember talking to my wife because she had a conference in Vancouver. We were sitting, I think I was talking to my department chair about, oh yeah, we're going to go to Vancouver and go to this conference. We're going to get on a plane. Everything's going to be fine. And of course, I think a couple of weeks later, everything just went suddenly online, right? And so, yeah, it was challenging in many ways. I think professionally, it felt like wearing many hats, right? So in addition to being a professor, I was some of the time sort of there. It felt like I was their listener, trying to help them. Students are balancing part-time jobs and caregiving, doing homework, and even their own mental health, and sometimes fear for, their very existence, right? Meaning, I think I forget how terrible COVID was. People died, right? And then millions of people, and so I think that fear really permeated through the classroom, virtually and in person. And I think it was difficult for me to figure out how to keep all the balls in the air, right? To juggle everything. And on a personal side, my two lovely children were also doing school online. So like, I remember sitting in the living room, teaching a class on my laptop, simultaneously supervising my kids' online learning, and I think our dog was barking in the background.
Well, and your wife was at the hospital, right?
Yeah.
That's right.
So you were home solo parenting just for that time because she couldn't come home.
Yeah, during the early days, she sort of, we didn't exactly know how transmission worked and how people got sick. And so I think just as a safety measure, she decided to temporarily live in her office at work and, didn't come home for a couple days. And so, yeah, it was sort of like constant power play around the clock, right? To use a hockey analogy, which is sort of like 1-on-2 plus dog.
Your inner Canadian is coming through.
Yeah, exactly. And so, yeah, it wasn't, in some ways, in Russia, as I look back now, I think if the pandemic hadn't happened, I like to think that I would still be teaching, but, that's not how circumstances played out. And, yeah.
I mean, you chronicled the experience in that article in the Chronicle of Education of walking away from your dream job. Can you describe sort of how that realization emerged, sort of when you started to recognize that what you were doing and how you were functioning wasn't sustainable?
Yeah.
When you realized that you had to move away from it?
Yeah, I think part of the challenge was also the teaching load that I was navigating was sort of 4 classes a semester. And so if you multiply that by 25, 30, it ends up being, 100, more than 100 students each time. And so
in your first year,
in my first year,
having gone online for the first time ever, I
Yeah,
mean,
exactly.
just adding, amplifying correctly here.
Yeah. And, I remember like, I think people scrambled published books about like teaching on using Zoom teaching, and Flower Darby had a book out called, I forgot what it's called. It's sort of like she had basically a how-to guide that I referenced heavily as a way to quickly adapt to, the shifting landscape. Yeah, and I think looking back, we were all probably doing the best that we could, trying to navigate so much uncertainty and trying to take care of our loved ones and pay the bills and stay healthy and control the things that we can. And so I think, I haven't had a chance to read that article in full, to be honest. And Becky Supiano, who's the journalist who wrote the story, I met her at a conference online, coincidentally, and sort of just stayed in touch. And I sort of think about, we would have these phone calls, and I would just be walking around the neighborhood, and she would ask me questions, and I would try to answer them. In some ways, I sort of see it as, oddly enough, like talking to her, saying those things out loud helped me better understand and in some ways cope with the demands that were put in front of me, right? As a teacher, as a husband, as a father, as a son, as a human being. So yeah,
it really just speaks to just timing plays such a role in anything we do in life, and you were on the unfortunate side of it here. How about I don't want to say we just have a few minutes, so I want to make sure we have a little bit of time to talk about what you're doing now. So it's a big pivot from teaching, but you're still in the public health arena. I don't want to ask you if you've found a new dream job. I'm not going to put that on you or put you on the spot like that. But how are you since then? What's your role like now? And do you feel like this is cool?
Yeah. If I may, I want to rewind 30 seconds and just say that I don't think I was unfortunate, right? Like, because I had a job that paid well and met my needs. I had a roof over my head.
Yes.
I can, I think all of us can think of so many other cases that were hit painfully and deeply by the experiences of the pandemic. And so I think in some ways I have the privilege of saying, hey, I'm walking away from this and I'm going to go try something else. And so I don't think I was unfortunate by any sense of the word.
Yeah.
Right. And, my spouse also works. And so like, I think that's also what gave me the opportunity, the comfort, the financial security to say, I'm going to walk away from this job and try something new. And even the opportunity to discover and see what's out there, I think is in and of itself a reflection of my privilege. And so I wanted to acknowledge that. Yeah, as for what I do now, so yeah, I work for Nava Public Benefit Corporation. So it's been about a year and a half almost coming up. It's great. I really love it. I have no reason to leave. Feel like that's an understatement. Yeah. I work with really brilliant, thoughtful people in a cross-functional way, meaning I work with engineers, work with designers, work with product managers, and essentially it's a technology public benefit corporation where we are kind of exploring using AI tools to help people navigate the safety net, right? And funny enough, like I'm not a tech person, right? But like everything I learned in health services research and policy bridged so nicely into this work that I hadn't ever anticipated or expected. So part of my job, a big part of my job is like designing evaluation studies to really understand, are these AI tools that we are building for social workers, for community health workers, are they working as we had hoped they would, right? And why are they working? And if they're not working, what are the barriers and to adoption and to sustainability? And so, yeah, it's funny because so many of my colleagues are public health trained. And so in many ways, like this upstream, downstream thinking, the social determinants of health, it all comes into play. And basically our end goal is to try to get people connected to the safety net, right? So it's, supplemental nutrition assistance, which is the food stamp, EITC, earned income tax credits, childcare subsidies, housing subsidies, all these various safety net programs. And the reason that's important is because like right now we know sort of across the country, somewhere around 50%, only about 50% of those who are eligible actually participate in these safety net programs, right? And we can, the literature is pretty extensive at explaining why that is, right? There's stigma, access barriers, friction. And one of the approaches we're trying to look at is reducing the administrative burden of accessing these programs, right? You have to spend energy learning what the eligibility criteria are, what the application process is. There's a compliance component where you have to follow the step-by-step sequence. You have to submit paperwork. You have to attestations. And then there's sort of like a psychological component where you just get stressed and frustrated. Maybe your application comes back incomplete. Maybe they tell you to submit even more information or come in for an interview. So part of the work is like, how do we leverage technology to reduce administrative burden so that people who need the help are able to get it quicker, sooner, more reliably? And I think, as public health practitioners, like that's a very upstream way of improving well-being, alleviating poverty, and helping to make lives a little easier for those who are struggling. So.
That's awesome. It's so interesting because I bet like that role, especially involving AI, when you graduated your PhD, it probably didn't exist, and it's so interesting. I'm bridging to my next question here, but and helping us wrap up here, but it's just it is amazing like how your PhD can translate to different jobs in different fields, and like a job that didn't exist probably when you were graduating, or you are now, and saying like how much all the work you did like fits in so nicely with your work,
and how effectively he was able to navigate a role sort of from a space, given your dissertation work and focusing on at-risk families and kids, to a space where you're doing very similar work with very similar at-risk populations.
Yep.
Yeah, I think, the PhD superpower that I think we all sort of learn and develop is being able to learn quickly, I think, and figure out, maybe the terminologies and the models and the views that are described in the civic tech space that I'm in now are essentially equivalent to these terms that we use in public health and health policy, right? And so I think part of this is like learning to identify what are the commonalities and how we can in some ways exploit those, information that we already know. And for those that we don't, we can quickly kind of get up to speed on it just by learning and talking and asking the right questions. I think there's so many other things that we learn in grad school that are valuable in industry. I'm sure Jeff, your previous guest can attest, right? Like being able to use analogies to explain complicated concepts in plain language, being able to write effectively, right? Being able to talk to different audiences and explain to them why this is important or why you should care and make an argument and support it with evidence. Being able to critically analyze a claim and figure out, should I hold on to it? Is this evidence that's worth actioning on, or is this something that requires additional data, right, to strengthen? So, yeah, I think in many ways, grad school prepared me for this job I'm in now. I mean, I think what's fun is, in some ways, a PhD is universal, right? There's so many things. Like, it just depends on what job you're working at. I think inevitably there's skills that we learn in grad school that can be applied to just about any context, including fatherhood or being a dad. So
I think that is a perfect place for us to wrap up. As it goes in a gigantic medical center like we're in, there's always some sort of construction going on, and I think we're about to potentially hear that on the podcast here. So, but I think that is a perfect place to wrap up. Michael, if trainees are listening and want to connect with you, can they reach out on LinkedIn? Is that the best place?
Yeah, please. I am more than happy. I'll say during my process of like navigating into academia or out of academia, I basically sent a lot of random cold emails and LinkedIn messages to people. And so many people just blindly and kindly gave me their time to talk about their work, to help me better understand what the work it is that they're doing. And part of that is for me to figure out, like, is this something I want to pursue? And so I'm here because of the generosity of so many others who, randomly agreed to talk to me. And I feel, totally up to chatting with anyone and share whatever I can offer to be of help.
Well, we appreciate it. Chris, appreciate your time. Michael, thank you so much for coming
both.
back to campus and
my pleasure.
talking to us.
This is great fun.
Yeah, thank you.
Thanks so much for tuning in to the latest episode of the Next Step podcast. If you liked what you heard, please share with other members of the University of Rochester community or anyone you think could benefit from these career stories. And we wish you nothing but the best in your own career journey. Until next time.